Virtually every leader in the health freedom movement talks about the insecurity of the food supply as one of the primary avenues of tyranny. Our family has rigorously sourced our foods for over a decade, and one of our favorite sources is Farm Match. And specifically, if you are in San Diego, Real Food Club PMA. My kids are literally made from their maple breakfast sausage and the amazing carnitas we make from their pasture-raised pork. But from regeneratively raised raw dairy products to the organic potato chips made in regenerative lard or anything you might get at your local farmer's market, our family's overall wellness and the security of our food lies in the hands of Farm Match and Real Food Club. I am so excited to be sharing about Farm Match and Real Food Club to offer Future Generations podcast listeners 10% off your first order. You can find the code and link in the show notes. Enjoy the rest of the show. Love and appreciate you all. The desire to go off-grid and disconnect from the system was one of the single most important initiatives any household could have. Whether it is growing our own food, becoming sovereign in our energy production and usage, establishing alternative communication strategies, or digging a well and finding the infinity of primary water. About a year and a half ago, our family moved into our new home in North County, San Diego on 3 acres of precious land here in America's finest county. One of the first things we did was hire Food Forest Abundance to design a regenerative layout for our land. From the different trees to plant differing berry guilds and synergistic pollinators, to consulting on alternative energy, collecting our rainwater, and even helping us find our local well guy, Food Forest Abundance and their Freedom Farm Academy has been pivotal in the gradual and consistent evolution of our household towards true sovereignty from the system. They have helped us simplify a very confusing process and helped us create the design of our dreams. It doesn't matter if you have 3 acres, dozens or hundreds, or just a small yard. Food Forest Abundance has something to offer you and your family in your journey to move your entire household off-grid. Use the code TheFutureGen to work with the absolute best in the world, Food Forest Abundance, to create your own freedom farm and get off-grid at a discounted rate. Welcome to another episode of the Future Generations podcast. I'm your host, Dr. Stanton Hom, and this episode with Dr. Kelly Blodgett, Portland, Oregon, Holistic Dentistry. We talked about this before we hit record, and then we talked about it a few times after we hit record, that biological dentistry in my practice, a holistic pediatric and prenatal chiropractic practice, is often the number one asked for referral, but also sometimes the number one delivered referral, whether somebody asks or not. And a lot of people are starting to recognize the nature of toxicity in a neurotoxin so ubiquitous as fluoride. Since 2015, we've known that fluoride is a radical neurotoxin, to go as far as like heavy metals, mercury, amalgams, and the way that they affect the nervous system. But he went further, and I am so grateful for it, of the many dental procedures that are so radically impactful to our disease processes that largely he told some stories about fertility transformations in men. He talked about the number of people who have had their lives restored largely because of sometimes as simple as undoing the previous work that had been done. He talked about so many inspiring things, 30 years of living a very inspired life, and he inspired me. I really appreciate everything that you shared, Dr. Blodgett. I know your interview is going to go far and wide, and I know for a fact that the number of people who actually listen, embody what you shared, their lives are going to be dramatically transformed for the better from the inside out in terms of their holistic, optimal health and potential. Love and appreciate you all. Please share this episode far and wide. Welcome to the Future Generations podcast, providing you with the world-changing content necessary to inspire you, your family, and our planet to a life of optimal health potential. We'll help you make the choices that powerfully influence the lives you bring into this world. It's time to strengthen our resolve, do better now, and for our future generations. I'm your host, Dr. Stanton Hom. Okay, welcome to another episode of the Future Generations podcast. I'm your host, Dr. Stanton Hom, and I have with me a very special guest. And I was telling Dr. Blodgett, Kelly, before we hit record, that biological dentistry, holistic dentistry is by far the top referral that we get in our prenatal and pediatric chiropractic practice. Everybody's looking for less toxicity, but also maybe a more whole body approach when it comes to teeth, when it comes to the mouth, when it comes to virtually everything that happens in this region. I think there's so much synergy between chiropractic, the cranium, the upper cervical spine, and biological dentistry. Dr. Blodgett, I am so honored because I've been following you for some time. I've been watching your account just absolutely explode. And just so you know, I have, before I studied chiropractic, I studied Weston Price. And before I studied, virtually anything that had to do with the spine and the nervous system, I was learning about many of the things that he was promoting back then that are largely just the most reputable, but also the most trendy biohackers. And he has been talking about it for over a century, looking at ancestral people. Dr. Blodgett, I would love for you to introduce yourself and love to get going.
Great. Well, thank you so much. So I'm Kelly Blodgett. I live here and have my entire life in Portland, Oregon, which, I love this time of year when it's 85 degrees and sunny. And I've been practicing dentistry for a little over 25 years now. And my practice has gone from more of a technologically centered practice in my early days, and then incorporating kind of psycho-emotional components and respecting how people feel about things, more the humanistic side. And then in the last decade, we've really developed into this very strong biological dentistry / holistic oral health practice.
Wow.
And now it's primarily a practice where we care for, it's like we do dental tourism. People fly in, they kind of get everything set right in their mouth and their, dental conditions and such. And oftentimes that allows the healing and energy to start flowing again. And we work in tandem with a lot of other healthcare providers like you, where it's like we're all working as a team, and it's just awesome.
I think it's a beautiful thing, knowing that, over the last, we could say 115 years with Rockefeller medicine, over the last 4 years with the amplification of, a single narrative, what's acceptable, that there are these maybe professional alliances that are really, really getting rooted, fully pun intended, with the dental aspect, in ways that really facilitate whole body, whole system, holistic healing. And like I was sharing with you, I learned about that long before, maybe 20 years ago, now dating myself.
Yeah.
I've only been in practice 14 years, so I can't imagine what I'm going to be like, when I'm at your stage, 10 years further into this thing that we do. But that's something that I love about you, is there's a level of authority that's very humble at the same time and very empathetic. That is maybe through the lens of the miracles that you've seen.
Yeah, absolutely. It's funny, I've shared this story a few times. The first time that we had a woman call our practice, and this was like a decade ago, she asked my front office person, who had been in dentistry for 40 years at that time, she says,
Wow.
I've had these 2 root canals and my health has gone down ever since. I've seen 3 or 4 dentists. They're all telling me they look fine. And she's like, I know intuitively something is not right with these teeth, and I'm wondering if Dr. Blodgett would take them out. And astutely, my front office person said, well, I know he enjoys helping people take out dead teeth and heal well, but we'd want to talk to you about your goals and so on and so forth. So she came in, and I think at that point I'd never actually taken out a tooth just because a patient was asking me to. Certainly I do believe, and I did then and still do now, that, a dead tooth, a root canal treated tooth, is in fact loaded with microbes. It's not an appropriate thing to have in living jawbone. And so anyway, she came in, she did ultimately decide to have the teeth taken out. We took them out. And when she came back 2 weeks later, I mean, the change in her energy and her demeanor was shocking. And it was, I
Wow.
mean, she even joked around. She said, my husband's kind of upset with me. And I'm like, well, what what do you mean by that? She said, well, you know, I used to just come home and sit on the couch and I wasn't, up for going out all the time. And now I'm like, it's time to get back to living life. And he's like, not used to this. Um, but I was like, wow, how many people had I seen the 15 years prior who were probably suffering in a similar way? And maybe they were even saying things that I didn't know how to hear at the time.
Wow.
But boy, that experience really opened a gateway of helping other people's bodies to get back to the innate wellness state that they were born in.
It's we have this phrase in our office, it's on my hat right here, expect miracles. And it's I think maybe one of the guiding principles that would be, umbrella to both of our professions in a sense that the body is this self-healing, self-regulating thing that has this infinite wisdom that largely we've been brainwashed into believing doesn't, right?
Yeah.
It's either that it's not there, but then I go further sometimes and tell people it's like they somehow convinced us that we are not self-healing, but they've somehow brainwashed into us believing that we are genetically made for destruction. Like and you can show just in one story, which I imagine you have hundreds, if not thousands, where something as ubiquitous as could you explain that a little bit? Maybe is it as simple as that? Like, hey, root canals, dead tooth, living, essentially still taking real estate in the jawbone
Right.
as a form of, toxicity that causes demise? Is it that simple or is it
Yeah.
bigger than
Yeah,
that?
I would say it's two things primarily. I mean, this is trying to, if we can, consider the root canal procedure in a vacuum, which I know is
Mm,
ridiculous because there were all these health shifts that occurred prior to a tooth dying or becoming infected or whatever. But let's just take a root canal treated tooth as it is. Once we drill into it, remove the living blood supply, the nerve connection, the lymphatic drainage within the tooth system, and fill it with oxidized materials,
right.
like root canal fillings, um, that now becomes, if you consider it like an electrical circuit, that now behaves like an energetic resistor. You're
Wow.
right. So anybody who's familiar with building electrical circuitry, if you put a resistor in the circuit, it's going to decrease energy flow. Therefore, all of the organs that exist along that meridian will also experience a decrease in energy flow. Now, that doesn't mean you're going to become sick. Some people may and some people may not. But the energy shift is certainly, and we measure that in our practice using acupuncture meridian assessment, a means of testing energy flow along meridians.
Gotcha.
The second thing is the roots of teeth, or I should say the dentin, which is like 85% of your tooth structure, it's porous like a sponge. When you look at it under scanning electron microscopy, you see it's literally just millions of tubules, like 20 to 40,000 tubules per square millimeter, right? I mean, it's a ton.
Wow.
And so you think about like there's literally millions of these tubules between the enamel and where the root attaches to the bone. That might be 3 or 4 millimeters of height, and that whole band of tooth structure is just sucking in microbes once the body's immune system is no longer attached to it. And of course, you can imagine how living bone appreciates, being sarcastic, of course,
Of
right? It's like
course. Yep.
it does not appreciate having microbes entering the system. It would be no different than walking around with a chronically open wound on any part of your body. Any physician would be like, well, we got to clean that up and seal it up and allow your body to heal. But in the case of root canals, because of this post Weston Price idea that, well, we've got to save teeth at all costs, you
Right.
know,
Right.
good health be damned.
Hmm.
And it makes no sense. And I'm not here to say that like nobody should ever have a root canal. There are certainly some instances where it might be the best of a bunch of crummy options, right?
Yeah.
And so, I mean, there are such, particularly for those who are listening, particularly for young people. I mean, you can imagine how many people we see that either recently or a long time ago had anterior tooth trauma because they were having a good time, skateboarding,
Right.
surfing, riding bikes, things happen, right? I mean, accidents happen. College students with beer bottles, I mean, stuff happens. And so, like, if your head has not yet finished its full growth and development, there's a strong argument for doing a root canal and letting the tooth go for a ride with the bone while it's completing its maturation.
Wow.
But once you get to that point, then it's a good time to start thinking about, all right, at what point in time would it be safe, health promoting, wise, however you want to look at it, to replace that chronic source of toxicity and put something in that's more biologically compatible. And so in our practice, that looks like ceramic implants these days. Um, not that titanium implants are all bad. There are some types of titanium implants that can work for some people's biochemistry. Uh, Typically, we suggest that people get what's called a biocomp test
Mm.
performed so that we can know of all the dental materials, filling materials, crown materials, implant materials, you name it, um, what's compatible with your body.
Wow.
And then we can choose specifically what makes the most sense for that person.
What does that test? I guess what does that test?
Yeah, so it's looking at the body's immune response to, I think, 80 different elements.
Wow. Cool.
And
Very cool.
so I'll tell you, one of the things I have found so interesting over the few years that we've been working with Biocomp, there's a ceramic material. It was kind of like, if you think about like, why is Coca-Cola still so popular in the
Hmm.
soft drink industry?
Hmm.
Because it was the first to market, right? So the ceramic material called Emax, which is a really pretty ceramic, it's very strong. Um, it is called a lithium disilicate ceramic. And it turns out, so, like in the past 12 months, every single person that we have tested, they've tested really healthy to every product I have in my office. They test very poorly to the lithium disilicate.
Interesting.
And it's like, huh, the sad part is it's one of the most commonly
Common. Yeah.
used ceramics in dentistry, and nobody's testing. Or I
Wow.
should say, very few dentists are actually going so far as to find out what's that person's body's immune system going to do with that material.
Wow. Doc, before I get too far, I'm always curious on how people get to where they are. You kind of alluded to this kind of evolutionary nature to how your practice has shifted over the years. And, I would say you are one of the maybe more prevailing voices in your field currently. And I'm curious how you, like, why are you who you are today?
Oh yeah. Well, the short and sweet answer is that when I was 21 years old, I was 2 months from graduating from college with my degree in psychology, and I had already been admitted to a master's program where my whole intention was to become a counselor and work with people in that regard. And up until that point, April of '93, like I had no spiritual life whatsoever. Um, and I accepted Jesus Christ as my savior as a senior in college.
Wow.
And as I started working a prayer life and developing like a relationship with the Lord, I literally heard God call me to become a dentist and reverse the negative stereotype of dentistry at
Wow.
21.
Wow.
And I was, of course, part of my prayer life at that point was like, God, why? Why did I get a degree in psychology? Um, and here I am, 31 years later, really appreciating and being grateful for the experiences that I had back in college. Like I worked on a crisis line, for instance, my entire senior year of college.
Wow.
And it's a very similar experience for a lot of human beings when they come into a dental space. Um, like they have been through past trauma, whether it's physical, emotional, what have you. And like we've actually completely constructed the way that we welcome patients into our practice based on psycho-emotional dynamics
Wow.
first and foremost. Like we have an entire wing of our practice called the wellness wing. It's all like zero gravity chairs and comfortable stuff. And that's where new patient experiences start.
Wow.
So
Cool.
my oral health specialists, we've done away with the titles like dental assistant, dental hygienist. Everybody who works in my practice is an oral health specialist. That's what we do, you know? So we don't want to get caught up in the muck and mire of like, well, you clean teeth, you suck spit. You know, it's like, no, we care
Mhm.
for human beings,
Mhm.
you know? So by doing that and allowing people who are new to our practice an it's basically an unstructured amount of time to share what they'd like to share, and for us to listen and be patient with the process of getting to know them and understanding their goals, their timeline, their budget, all these things that come into what's it going to look like for us to be a part of your journey to wellness. You know, to basically get you back to feeling the innate wellness that you were born to experience.
Wow. Yeah.
So, you know, like I have no fear in what I do. I know God's called me to do this, and it's partly why it might look like bravery to some of my, you know, peers, but like I know this is what my calling is, and frankly, it's so much fun to get to meet people from around the world and watch their lives light up as we just remove the blockages to health that have been done in their mouths, not
Wow.
intentionally. I mean, you know,
Mhm.
every dentist I believe is doing their best, and I believe most you know human beings are doing their best, right? But for those who are tired of suffering and where dental stuff is in the way, you know, that's what God put me on this planet to do. So it's been a remarkable journey and continues to be so. And yeah, can't wait to keep doing it. It's so fun.
It flies in the face of, what I just remember being early in practice and being in networking groups, and there's always a dentist because they're just so much more better at business than chiropractors are. And I remember the first dentist that I networked with, and just hearing, because very different practices, conventional dentistry, and then I practice more like you do, and we swap services, and it's just okay. That was dentistry. That's typical. I've had a lot of dental work in my day. That was a great experience. I like this person. And when the tables were turned, like the layers of stress and the layers of like even expressing to me like, hey, did you know that dentists have some of the highest suicide rates? And I was like, whoa, I'm not tracking, suicide rates in any capacity, but this provider was like, yeah, it's like extraordinarily high. And I had no clue from the outside looking in. It's like, hey, it's a great, good culture authority. There's no real like competition and the infrastructure. And then most dentists you meet are successful, but on the back end, there's a layer or multiple layers of so much stress and trauma that I think going to the office brings to them in some respects. And it's interesting because you're not like that in any
No.
capacity, And it obviously, you have to say, and I thank you for sharing, it has to be because of your faith. And it has to be because of, being guided and being chosen and being called. But on the opposite end, it's like, I think there's definitely a black and white experience of conventional dentistry to conventional practices, something as ubiquitous as, ceramic fillings, being a highly toxic thing that people don't even have a fear of right now compared to, the mercury amalgams or whatever it is.
Right.
And but then contrast that, with a zero gravity environment, a wellness wing in your practice, a psycho emotional perspective, and then also just like being on that dental tourism where people are flying into seeing you. And it's this remarkable experience transforming their entire like journey. It's
Yeah.
remarkable.
Well, thank you. You know, I was reflecting this morning, doing some writing, you know, as I do for my Toxic Tuesday and Wellness Wednesday. And um, this past week, I had received an email from a woman in South Carolina. She wasn't able to come to any of my toxic tooth tour stops. I went around the country for 4 months, like
Wow.
every other weekend, flying here and there to actually get face to face with people who wanted to talk about this and get real. Anyways, but she tuned into the the live feed one that we did, live stream, and oh my gosh, I'm actually going to share her email in a couple weeks on my Wellness Wednesday because it was so powerful that it was like all the gears clicked in for her. The It acknowledged what she intuitively sensed, which was, these teeth are killing me. And this poor lady, she had like 7 root canals, right?
Wow.
So for this young woman to have and they're all her molars, to have all of her molars removed, and to think about the replacement of those, the time, the stress, um, how much better. Well, first of all, how nice is it that she's taking ownership over her health and feels empowered? Uh, and how much more valuable is it to come to that experience with this sense of hope and encouragement?
Right.
You're going to heal better. It's so awesome. Anyways, it was such a gift that she gave us.
Doc, through your lens, what would you say is one of the biggest challenges humanity faces today? I know it's a loaded question.
Wow. That is a loaded question, man. We could go in all sorts of directions.
Mhm.
Of course, I have my knee-jerk response is to think about it through the lens of dentistry, and so I'm going to take that path. I think I could take some others, but um, I do think that from the perspective of dentistry, we have been normalizing craziness. Just as it is as crazy when I turn on the
Wow.
TV at night to watch an old episode of Friends, to have a laugh before I go to bed, that every dang commercial on there is for some drug
Wow. Yeah.
that like if you don't take Jardiance or whatever the heck people are, they're advertising, like how are you going to live this fulfilled, beautiful, colorful life that they're, and oh, by the way, it might give you, chronic diarrhea and kill you.
Right.
And the fact that like nobody actually needs any of this stuff. But we have convinced people that if the majority tells you, like, let's say root canals, if the American Dental Association and the American Association of Endodontists says, there's, it's interesting, actually, the American Association of Endodontists, if you read their stuff and watch their videos closely, they don't say that um, it's been disproven that root canals are infected. They specifically say, because I've shown this video every time I do my toxic tooth tour, that it was discredited.
Wow.
Isn't that an interesting choice of words? Because it's like, well, the powers that be said we don't want to buy that because that's how we make a living. So we're just going to allow you to keep believing that it's a healthy choice, even though it isn't. Um, I just love out, and I say that out loud to people. I'm like, okay, do you think there's a difference between saying something's disproven and discredited?
Wow.
And they're like, yeah, So, anyways, to answer your question, it's that people have bought the craziest things, like, real blatantly obvious, for instance, is that we're all going to die because of this, mystical virus. You know what I mean? Like
Hmm.
I look at it and I go, people get viruses. It happens. Arguably, your immune system doesn't mind doing battle with the virus now and again so that it strengthens itself and your immune system becomes more knowledgeable. It's like that's part of our experience. But no, we want to convince you that you need big pharma to, make vaccines and yada yada. And again, I'm not making any judgment about anybody's choice to do or not, take or not take vaccines, but it's like, just come on now, like, let's use common sense. We do get exposed to these things, and life sucks sometimes. Some people are going to die from that, and that's going to be a real big fat bummer, but it's also part of life, you know? What's not part of life is teeth breaking down and gums having disease when, going back to Weston Price, we follow primitive diet
Wow.
structures, you know? And but if you switch and think like, oh well, aren't Hostess cupcakes and Mountain Dew, like that's fine, right? I mean, these people are jumping dirt bikes on TV and they make it look so fun and awesome. And it's like, no, that's actually going, that prescribed diet of garbage is what's going to sink your battleship of health, teeth included. It's craziness.
It's it's crazy when it's the only acceptable perspective, right? And
Yeah.
I'm sure you experienced this too over the last 4 years. It's like the old mantra used to be follow the money, then it was like very quickly follow the control, and
Yes,
then then
absolutely.
then it, then it became follow the censorship. It's like you can almost see where the target is by how quickly you get censored,
Yep.
and it's pretty remarkable because when you put it out the way that you do and you just make up a drug name, you can make up a drug name, you could paint the picture of a commercial, you could probably rattle off 75% of side effects that are on 75% of drugs, and people chuckle, or they chuckle about it because they just know that that's just how it is. But when it comes, push comes to shove, some percentage of the population are trying to find you, but the majority of the population is just like they chuckle and they still go into that system. They still go into that only acceptable narrative.
Right. Right. Well, and of course, on top of that, we've convinced people that if your insurance company, the gatekeeper of your healthcare, doesn't, say that it's appropriate. By the way, these are people who you've never met. They've never met you. They've
Mm-hmm.
never examined you. They have no medical degree, but you're going to allow them to be the gatekeeper of what you
Mm-hmm.
do or don't have as a health choice. That, I mean, that to me is, it's ridiculous. And I'm seeing people. I mean, this is the sad part of what I experience on a week to week basis, is that usually my practice and my team, we are helping people at oftentimes the last stop on their health train. They've tried everything else and they're like, man, I've done X, Y, and Z and everything that my naturopath, chiropractor, acupuncturist, physician, you
Right.
name it, shaman, healer. And do you think it's possible that these 6 mercury fillings and 2 root canals could be impacting my health? And it's like, yes, I do. It's hard not to chuckle, but it's like, absolutely. And the cool thing is, by the time they get here, usually they're like, we are in and we want change. And I think that uh, it's easy to underestimate the power of belief. Um, Once one of the questions I like to ask people is, what do you see yourself doing that you're not doing now in 2 to 3 years as a result of managing this part of your health that's been so impacting you?
It's a
And
great question.
if they can tell me like, oh man, I'm going to take a camping trip and I'm going to do some hiking with my family and I haven't been able to do it in years. And I'm like, awesome. Like this is going to be fantastic. And for those people who haven't considered it yet, at least we're planting seeds of the power of using your visual mind.
Wow.
So it's that I know that's not what they teach you in dental school, but that's the secret sauce, the power of belief.
I think it's a beautiful thing. The founder of chiropractic called, he essentially said like the three causes of what we would call interference to the nervous system, subluxation, were the three T's: traumas, physical traumas, toxins, and thoughts. But thoughts,
Mm,
if you actually read his textbook, it was called autosuggestion, right? And we can get into placebo, and we can get into the fact that placebo is so marginalized in conventional medicine, conventional science. We can get into nocebo on how you can actually suggest to people, like ridding them of hope by giving them a horrible prognosis.
right.
But you're talking about shifting that even further and saying, hey man, 2 to 3 years from now, like what can you create in your own mind of what is possible for you should you be able to be free of what this health challenge is. And that's a remarkable step that I hope people are getting that, right? And do
Yeah.
people get that? Do people get that when you when you bring that question into their consciousness?
Yeah, I mean, for those who already have a vision, I acknowledge like what a gift that is. And, I can't wait to be a part of texting them and hearing from them. Like I'm thinking of this one guy who had come in maybe 4 years ago from Bend, Oregon. He and his wife could not conceive. And he had horrible infection with his anterior teeth. And, again, like we were the last stop on that journey. And we ended up taking out the teeth, cleaning up the infection, and just making him a partial denture. This guy in his like late 20s, early 30s. And he's like, I can't afford the implants. I just need something to have a smile. And oh my gosh, I now get texts from him at Christmas, showing like their 2-year-old.
Oh
And it's
man.
like, wow, like the power. It's like, and of course I share that stuff with my team, and we all recognize the incredibly blessed opportunity that we have to be of service to others. It's what makes it so amazing. It's hard work and so rewarding.
So many people have asked me what I do to stay mentally and physically resilient in the midst of the unending polarization, fear, and tyranny. Literally nothing has made a bigger impact for me than daily cold plunging. 3 minutes, 37 degrees every morning for over a year now. My friends, I wanted to tell you about the Edge Tub from Edge Theory Labs. Their portable and inflatable tub can alternate between an ice bath and hot tub. I've been regenerating the benefits of cold plunging every day, like better sleep, better focus, and more energy. We have had some really amazing interviews to learn more about cold exposure. But in the meantime, I invite you to check out Edge Theory Labs' website to learn more. I'm also happy to share an exclusive offer for Future Generations podcast listeners, $150 off using the code TheFutureGen. You can find more info in the show notes. Get cold. What's up, FG fam? One of the single best companies whose products have supported the optimal wellness of our family for years is Earthly Wellness. Kate TG and her team have stood for truth, health, and freedom in ways that paved the way for so many of us. They experienced heavy levels of censorship long before it was popularized, and they stood strong and persevered. Their products are clean, cost-effective, and honestly, they work for all ages. From supporting my wife, our oldest, and our little guy, Earthly Wellness provides products that have been foundational for our family for years. We especially use their products right before bedtime. Their Feel Better Fast and other herbal tinctures are some of the best in the world, as well as their amazing Goodnight Lotion, the magnesium oil, are mainstays. I am so excited to be partnering with Earthly to offer Future Generations podcast listeners 10% off your first purchase. You can find the code link in the show notes. Enjoy the rest of the show. Love and appreciate you all. That actually leads me to something I really wanted to ask you. And a part of my training, and it's not how I foundationally practice, but a part of my training is going through a lot of work with applied kinesiology and learning about neurologic tooth, learning about neurolymphatics, learning about obviously the cranial vaults, the acupuncture meridians. And I'm curious, because that might be a leap for some people. They might listen and be like, hey, like why those teeth? And why does that lead to a better male fertility, right? Most people don't know that fertility issues are 100% the weight of the world on women, but population-wide, it's actually 50-50.
Oh, yeah.
And you're actually giving me a brand new avenue towards that level of success where you noticed that there was a significant connection between that person's ill health or lack of optimal health and teeth leading to fertility.
Totally. The number of men and women. So, we appreciate that the upper four incisors and lower four incisors are connected to like urogenital organs. The number of women that I've met who either have and again, of course, the front teeth are sticking right out there. They're one of the most common teeth that people bonk. Happens to so many folks. and they end up having root canals, right? Because it's like that's what
Wow.
they're told to do. These things, whether they're abscessed or not, become an energetic blockage and a source of microbes chronically. And the number of women in particular that I meet who tell me, like, I'd never had a bladder infection in my life. Ever since I got that, had the injury in the root canal, I'm in the hospital every 3 to 6 months with bladder infections that are so bad they got to put me on IV antibiotics. Or men who are like, I had this root canal 3 years ago and now I'm diagnosed with prostate cancer.
Wow.
And I'm like, well, I mean, there's certainly could be a lot of causes. However, why don't we, at the very least, consider testing? And so this is where sometimes we'll do the energetic testing in our practice. If we need the deeper dive, I'll refer them to some of the people I know around the country that do different forms of energy testing, whether it's, like Dr. Klinghart's version of muscle testing, the ART, autonomic response testing, or Dr. Simon Yu in St. Louis, Missouri, and his acupuncture meridian assessment.
Good.
I've worked with people that do the pendulum stuff. I love it all. It's like, I don't really care which path we take in terms of energetic language, as long as we're asking the body questions in the realm of energy.
Wow.
It's pretty cool.
That's awesome. The You talked about this calling at 21, and I'm curious if you could verbalize what that calling is. I know we've talked around it, but maybe in verbalizing what your mission and your purpose is at this stage of your career.
Yeah. Well, the way that I heard it at 21 was verbatim: become a dentist and reverse the negative stereotype of dentistry.
Wow, man.
And again, I was the only person in my dental class of 70 students who had a degree in psychology, right? Everybody's there with a degree in chemistry, biology, micro, physics, whatever. And I was like, well, whatever. I mean, that's just my path. Again, I didn't appreciate at that time how powerful that would become in the future. Um, what I believe, three plus decades later, is I want people to understand that it is your body desires to be in homeostasis and balance in a
Yeah.
state of health. I think Jeff Bland's book, that Disease Delusion, it's one of the best books I've read in my career. Looking at this idea, talk about brainwashing, right? We use words,
Right.
whether it's in dentistry or medicine or whatever, telling people you need these procedures and you have, or you are, like, you are diabetic. You're now being defined by a disease state that your body wasn't meant to experience from birth.
Right.
So we don't look at, like, well, what were the things that influenced you epigenetically, such that now your body expresses disease rather than wellness. And that it's in fact true that for a lot of conditions or a lot of symptoms that we're experiencing, we can actually remove the blockages and your body can become well again.
Love it.
It's like that's how we're designed to be. But, whether it's smoking cigarettes or weed or, drinking soda, or, I mean, there's so many of these, like, luxury things that we get to do because we live in particularly in a country where it's like we have so much means to buy as much garbage as we want. And I forget, like, what percentage of an average grocery store now is prepackaged processed garbage. You know, I mean, it's so ridiculous that, like, maybe the fresh produce might be not even 10% of what's in a grocery.
Right. You said a phrase earlier that I would love for you to qualify, although I think a lot of our listeners will be very versed in it, but I would love for it to come from you. You said primitive diets,
Yeah.
and I would love for you to kind of talk through what that is through your lens.
Absolutely. And I'd love to share that one of my favorite books, like, I've handed out hundreds of this book, The Dental Diet by Dr. Stephen Lin, a
Great book.
wonderful Australian guy. Gosh, he's just a gem of a human being. Um, That book summarizes Weston Price's work. And what I loved about reading it is appreciating it's, it's not just one path. Like, oh my gosh, you know what? If you're not eating grass-fed beef every day, you're not doing it right. The thing I love is that you look at primitive diets per culture, and there's so many varieties of that. If like you're an Aleutian up in Alaska versus somebody in the Southern Hemisphere or whatever, like they're going to have different foods available to them. The point being that the degree of processing is usually minimal.
Right.
Um, we're consuming those foods in their wholest forms. And I'm guilty of enjoying a processed food treat, but the older I get, the more aware I've become, of course, the more I'm looking to things that um, are as whole food like as possible. I a shameless plug for the new masa chip company. I don't know if you've tried these things.
Not yet.
Oh my
I'm
gosh,
seeing them everywhere.
a patient brought me in a bag and she said, all right, doc, she's like, I'm sorry, you're going to get hooked. But
I love it.
all it is nixtamalized corn, organic sea salt, and organic beef tallow, like grass-fed beef tallow. And I'm like, well, that's a lot better than when I read the ingredients on a bag of Doritos. But I mean, that's kind of how I see it. Like, it's kind of like when I meet new patients and I ask them, like, do you prescribe to any type of diet? And the most obvious are probably the polarizingly different. I'm following a carnivore diet versus I'm vegan, right? And there's neither one of those are right or wrong. They're options. And so, for the vegan, I'm asking them, all right, cool. I mean, like that's great. Help me understand, how are you getting your fat soluble vitamins? Because some people are they're misinformed, about the healthfulness as it relates to what our bodies as human beings require in order to experience our greatest state of health,
I love
which
that.
by the way, 100% includes your teeth, the bone that support the teeth and the gum tissues that surround the teeth. Like, if we're shy in, well, like, I'll give you an example. We had a patient come in 3 or 4 years ago. This is insane, by the way. She was told by her oncologist that she had this condition, some blood condition, that she's probably going to die from this in the next 10 years, because that was like, he didn't know anything different. And I'm like, this makes no sense at all. You're like 32 years old. You eat a great diet, generally speaking. But she was on that vegan side. So I referred her to the functional nutritionist here in town that I work with. And she went through, full workup, found out that her vitamin D level was like 8,
Wow.
basically non-existent. Um, she did the craziest thing, again, sarcasm, sorry, but like, she had her take 10,000 IUs of vitamin D a day for 3 months and then retested her. All of her symptoms went away. The blood levels totally normalized. And it's
Wow.
like, oh my gosh, I love how you said, use the phrase, uh, oh gosh, why is it escaping me? Nocebo,
Right.
nocebo, right? Like, oh, you know what? Sorry to tell you, you're going to die. And it's like, that, that's, that's, that's nuts, you know?
I think it's nuts because it just comes out, right? Like I don't know where they get their quote data from. And then I started to learn, because we went through some interesting like journeys with our son, the entire medical legal conversation, that there is this whole concept of, if you inspire too much hope in people and it doesn't come true, that people can sue you. And I remember being in school and they'd be like the society's litigious. It's like, I haven't found that to be true. If you're
Yep.
actually honest and you're actually uplifting from a very like genuine place, that it's not such that,
Right.
and I appreciate you sharing that, because I think in the end, the contrast between what people are, I would say, if there's a running thing, there's such a contrast between what we are told versus what is the reality. And I believe that you're highlighting so many aspects of things, something so simple as fat soluble vitamins and
Right.
their deep, intimate relationship with optimal human, performance and health.
Totally.
I would be remiss if I didn't ask you a question because the majority of our listeners are parents.
Mm.
And the whole kind of conversation, especially in dentistry, is an interesting thing when you start to look at kids and you start to look at all the different aspects and a lot of different things that happen in alternative worlds where it's tongue tie revisions and tethered oral tissues and
Yep.
midline issues and all sorts of things. I'm curious, if you were raising young ones at this stage, what would you kind of give parents that's a little bit off the beaten path that would be empowering, that would help them kind of navigate that world more,
Yeah.
more
Well,
empowered?
some real simple stuff. Because I get asked this question quite frequently, and to be completely transparent, like in my 25 years of practicing as a dentist, I really haven't seen children.
Right.
As it worked out when I bought my practice, I shared space with a pediatric dentist on the other side of the building. So all the kids went one direction, the adults came mine, and that's And I did my residency at the VA hospital where there were no kids. So, anyways, but as it relates to um, how best to support our young people in developing great health overall, mouth mouth health included. The things that don't matter, in my opinion, what toothpaste you choose. Now, I will say there are some toothpaste out there I'm like, I would not put that in my mouth, you know. Um, the most popular ones and typically the ones with the biggest budgets. Also mouthwash, you know. Like you look at these things like a Scope commercial, and it just looks like it's a magical cartoon ride of fun. And it's like, yeah, none of that matters, right? So for most people, and there's a why. It's not just because I'm dogmatically saying this. The why is that most of us, we put our toothpaste, whatever we're using, whether it's Crest or Boca or whatever, and we brush our teeth for tops, 2 minutes. Most people, it's 1 minute. So maybe you do that once in the morning, once at night. So you might maximum have 4 to, let's say, 5 minutes of exposure a day, and maybe it hangs around for a little bit. Most kids these days, that I've seen anyway, they are being impacted by what I would call squeezy tube culture. Like where everything mom's buying because it's organic apple puree, but
Gotcha.
it's something you can put in the back of the car or whatever, and it's like, open it up, squeeze it in. Or they get a little bit older, they get into grade school, and they want the super cool, new drink of whatever, and it's in a twisty top. Take a swig, throw it back in your bag. An hour later,
Mhm.
take a swig, put it back in your bag. And the chronicity with which people are exposing themselves to garbage, and,
Right.
and to make it even more broad and inclusive, we're talking like anything from your Starbucks, you know, 4 pump of caramel vanilla, you name it,
Wow.
coffee drink, or your 32 ouncer of soda, or your big twisty bottle of kombucha, and just keep going, right? Anything with
Mhm.
sugar and or acidity that you're exposing the mouth to over time that overcomes the saliva's ability to buffer the solution in the mouth and
Wow.
bring the pH back to normal is going to melt your teeth. So, people think like, oh, there's some magic nano hydroxyapatite I can put on my kid's teeth at night? It's like, no. I mean, maybe if you're willing to stop doing I'm sorry to say this, but things like on-demand nursing, I've seen so many children where it's like they're able to have access at like, let's say at 12 months of age, where, all night long they're able to put sugars in their mouth. It will melt down, It's maybe not as caustic as like lemonade, but still, it's slow offenses. I mean, this is what Hippocrates said,
Right.
2,500 years ago, that, it's the result of small daily sins that ultimately suddenly become a disease. And
I
it's
love that.
like, we're just exposing ourselves to things with too great a frequency that our body can't overcome over time.
What would you say are some of the inspired visions you have for humanity? Should we heed some of the things that you're talking about? Should we understand the essential nature to living as the ancestral people did, to understanding the connection between our mouth, our teeth, our cranium, and our whole body? As we understand, that there are toxic agendas that make money off of our sickness, and
Yeah.
contrast that with the reality of how absolutely brilliant like our systems are.
Yep.
What do you envision for the world? Should people actually realize that?
Well, I think that a good place to start is kind of, following the words of Jesus, and really we are called to love others. Like, as a very basic starting point, like, it's not my job to uh decide for or judge another person because of any of their choices. So I think starting and living in a state of love and acceptance of yourself,
I
first and
love that.
foremost, and then of others, is a really healthful. And I know that sounds like probably, how do you get to teeth from there? Very, very simply, when we are in a very high energetic state, um, we don't suffer diseases.
Right.
It's like our body's energy is almost immune to them. Um, when I think of what my daughters have grown up experiencing, and as it's relating it to like what my childhood was like, I think it's becoming increasingly challenging for people to steer clear of toxic thoughts and emotions. I mean, you look at like, who are the people who have the greatest, or they're garnering the greatest social media attention? It's stuff like, and no offense to the Kardashians, right? Like, I don't know them personally, but
Right.
it's like, okay, what? So it's all about looking a certain way and not accepting and loving ourselves as we are. I mean, one of the greatest beautiful things about humanity is our variances and differences. It's really cool. Um, but if we're all striving to look and sound a certain way and dress a certain way, it's like, I don't know. There's just, and the same thing happens with our mouths, right? Like the shame. So
Wow.
to contrast the heightened state of love, peace, and acceptance is these really directly negative, low energetic states of guilt and shame. So the number of people that I've met in my career who say out loud, like, "Oh, I feel so ashamed that my teeth got decayed and I had these root canals, and I don't like the way my smile looks, and I just I feel ashamed about that." And it's like, oh boy, every cell in your body is listening to your thoughts. So, you know, when we start to reflect and think about, like, what, it is what it is, like, start with acceptance. What happened, happened. It is what it is. We can't change the past, but what we can do is determine ourselves to think differently about the future. And there's so much power in that for people living great lives of fulfillment, which the teeth and the oral tissues go along for that ride. Um, yeah, so I guess the short answer is love.
I love that.
Thank you. That's what we try to live out here. It's like open hearts and open ears to create space to acknowledge a person's experience and then to help uplift them and bring in hope. I mean, that's what I want to see them. And by the way, it's one of the most common things I hear when people finish their new patient experience at their first visit is, "I can't believe I'm feeling so excited to go through this surgery," or blah, 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 whatever it is. I'm like, well, that's great, because your cells are starting to get fired up for better health, and you
Oh
know it.
wow.
And it's so cool.
I love that. How would you have people practically apply that? I love that. I love that you start and end with love, peace, and acceptance.
Yeah, thank you. Um, And I do appreciate that. How, how to accomplish that's probably going to depend a lot on a person's personality style.
Of course, yeah.
Um, we work a lot on that in our practice, understanding each other and how we think differently. Um, but ultimately, it's like when I think about, like, it's not my job to judge somebody else for anything. As a matter of fact, like, if anything else, like, and this is kind of biblical, that if we believe that in fact we are all born sinners and that we need the love of Christ to experience a reconnection with God, then my job is to let go. Stop holding on to you know begrudgment or disgruntlement, or I feel wronged, or I'm right and you're wrong, or like, and I've learned that the hard way in my own life, plenty of times, where it's like, why do I feel so locked up with, negative emotions? It's like, um, like I'm focusing on something I can't control. Why would I bother doing that? There's so much value in letting things go to the universe or to God and allowing energy to flow, you know? Um, how a person goes about that, I don't know, whether that's, finding a good friend to talk to, working with a counselor. I mean, I don't know, so many ways, listening to, reading Joe Dispenza, so many different ways, right? Um, or do all of it, you
Yeah.
know?
Yeah.
Listen to Peter Crone, um, great thinkers out there that are, I believe, were sent here to be guides for us. Um, yeah, I don't have a direct answer, I suppose, but I
I
think of
love
all
it.
those things come to mind.
I love it. I mean, I think we all know that feeling, when we do let go and when we do forgive and when we do. One of my mentors, a business mentor of mine, taught in one of our quarterly trainings recently. He just wrote 3 letters on the board, and it was GMF: grace, mercy, and forgiveness.
Mm.
And it was something that and it's a business, and it's like our quarterly planning training meeting. And he felt compelled that that was something from the inside out would help us maybe take that deep breath that you're inviting us to do the same, right? Love, peace, and forgiveness, or love, peace, and acceptance. Maybe sometimes in the face of somebody that maybe doesn't deserve it, or maybe, societally wouldn't deserve it, is something that maybe hierarchically or societally, maybe we're all being called to do, especially with how polarized things have become.
Oh, for sure. Oh my gosh, yeah, especially going into election season, right? Like,
I was gonna bring it up.
it's just
I
like, are
love
we
it.
not more alike than we are different, really?
I know, right?
Yeah, it's so many things to focus on that don't bring value, you know?
And so I will just say I appreciate your time. I appreciate your expertise. I appreciate your career in this journey. Talking through things that have been with you, called upon you for 3 decades is a remarkable thing. And I remember feeling those similar things. And I'm not the youngest guy in the world, but I'm about 10 years behind you in the professional career. And I feel like I remember when I was 5 years in, I was like, man, I know my shit. Like I'm, like you get to
Yeah.
that place, you're like, wow, like I'm not that new guy anymore. And you get like 10, 15 years in and you're like, like there's something there. There's a little bit of like, it's not ego, it's not arrogance, but it is a little bit of like this deep sense of confidence. And I think that's something that I was very drawn to you for is my, selfishly for myself to be able to be in this energy in this relationship with you, is that 10 years from now, I can feel myself living into some of these, levels of certainty, knowing that not only am I here for this reason, but that maybe the person that is coming to me is also here for a synergistic reason. And then through that space is this infinity of the divine and God
Mm,
that honestly, who could put a cap on that, right? Who
right.
could put a limiter on that? And if we do, maybe that's why we do have those feelings of disgruntled natures, to begin with, And so, how? how best do people find you? I mean, I imagine you're not difficult to find, but
No.
how do people stay connected?
Yeah. Well, I encourage folks, check us out, like follow us, please, on Instagram and YouTube. It's at Blodgett Dental Care, right up here, right? Blodgett Dental Care. And our website, blodgettdentalcare.com.
Love it.
Yeah, I mean, gosh, I've put out so many posts and videos, and people can also watch the Toxic Tooth Tour. Like, if you go to my website, you can purchase for a small amount, watching what I talk about when I go
I
out on
love
the
that.
Toxic Tooth Tour. And yeah, and then they can DM us. I mean, gosh, people DM us all the time. The smartest ones who really want help, they talk to Heidi or Kaylee and my team, and those are my new patient coordinators, and they just come out here and they experience the love and connection and get better. And our door is open for that. I mean, I'm 53 now. I plan on doing this a long time. It's, maybe not as many days, in my 60s and 70s perhaps, but it's so rewarding. Um, it's just a gift to get to help people, and I'm learning every day. I mean, what a wonderful way to live life, to learn through the people who bring us things through which we do learn. It's really cool. But yeah, we'd appreciate people following us and reaching out and coming to see us here in Portland.
Doc, what you shared today, I know I mean, you're the first biological dentist that we've had on our platform. And it's something that, like I said, it's one of the number one questions that we ask. And it's often not the question that they ask, but the number one referral I make, because of just knowing that the essential nature of just taking account true dental hygiene, and understanding that maybe there's some things that have literally been implanted in you that are driving a lot of dysfunction, that we are very, very blessed. Like 2 blocks from us is a very, very well-known biological dentist. And in the end, I think what you shared today is going to really, really help our community find the help that they need, but also help them just reinforce a lot of these amazing beliefs that, the infinite nature, maybe not infinite, but limitless nature of our human potential is far more than we've been led to believe. I really appreciate you sharing today.
Well, thank you so much. I appreciate, just honored that for the invitation, and thank you for this hour. It's been awesome. I've really enjoyed connecting with you.
As you probably know, I'm the clinic director of the Future Generations Clinic of Chiropractic. I wanted to invite those of you in the greater San Diego area to come check us out. We expect and experience miracles in our office every day, and would love for you to experience the same, as well as your family, especially your kids. This month, we're offering our new patient package for just $67 for podcast listeners. The offer retails at $349 and includes an in-depth consultation where our patients literally tell us we know more about their family's health in the first 15 minutes than virtually every doctor on their healthcare team combined. Our state-of-the-art clinical workup, including Insight nervous system scans, full spine digital x-rays, and a functional exam. We also include a full report of your results, a customized plan to realize your greatest health potential, as well as your first adjustment in our office. Check out the link in the show notes for all the details and claim the offer. Love and appreciate you all.